Hi and welcome to BioStock Studio. Aqilion has received positive phase 1 results from their study with drug candidate AQ280. The drug is being developed as a treatment for eosinophilic esophagitis, a very difficult disease to pronounce, but luckily we have CEO Sarah Fredriksson with us who will not only pronounce it correctly but tell us more. Welcome, Sarah.
Thank you.
So could you start by telling us a little bit more about this difficult to pronounce disease and how it's treated today?
So eosinophilic esophagitis is a chronic inflammation in the esophagus. So it's often detected in quite early age. And what happens is that the chronic inflammation, if left untreated, could lead to fibrosis and strictures. But the patients often notice this as very hard to swallow. It can get painful over the chest as well. And up till a couple of years ago, there was no treatment. It was first described actually in 1990s in the scientific literature. And the scientific community believes that the disease often starts with the food allergy.
So how does your candidate compare to how it's treated or not treated then today?
Okay, so it's both in the US and Europe, there was biologics approved recently. It's called Dupixent. And there is also in Europe a topical corticosteroid that has been approved for the disease. So now there is a treatment, and since there is a treatment, the diagnosis is probably accepted more, and there is an awareness of the disease now. Our drug candidate, the AQ280, is a selective JAK1 inhibitor. And we know that it inhibits those cytokines that are important to drive this chronic inflammatory disease. And we also know that Dupixent works. And Dupixent is also, it's directed against two of those most predominant cytokines. And with our drug candidate, we can inhibit, or we can dampen the effect of those two and a couple of others. So we believe that we will have a good effect, that the biology fits with our drug candidate.
So this was a phase 1 study, meaning that you looked at things, for example, like dosing. Could you tell us a little bit more about the results?
Yeah, so this was a phase 1 study in healthy subjects. And it was both a single ascending dose phase and a multiple dosing phase. And we were really happy to see that it's safe and tolerable. And the pharmacokinetics support the hypothesis we have that this could be given as a one daily treatment. And we also added a few biomarkers because we wanted to know, do we have a JAK1 inhibitor? So we wanted to see if we could follow that. So those biomarkers showed us a very positive result as well. So overall, we're very pleased with the study and now planning for the next step.
So what is the next step?
So we want to perform a phase 2 study in patients, of course, both in Europe and in North America. And we want to do it both like a dose-finding study, and we want to use regulatory endpoints, not only biomarkers. And if it turns out that we can be successful with both of these goals, we hope that this is the only phase 2 needed, and so we can then continue with a pivotal study later on.
And we'll finish with something completely different.
Yes.
Some signs that, or to me, some signs that maybe you are heading towards an IPO. You recently attended the SIX or the 6 IPO Academy in Switzerland. Can you tell us a little bit more about this?
Yeah, of course. Well, we all know how difficult it is to finance biotech company in general, and with this rather cold financial climate now, it's even more difficult. And to be able to finance then a full phase 2 and our other programs in the pipeline, we are looking very actively in different directions. One could be an IPO. Another one could be that you continue with private investors. And you need to keep both pathways open. This is about finding an exit for the investors. And when talking about an IPO or just a private placement round and wait with the IPO a little bit, we believe that we need to work with other countries as well, investors from Europe maybe. And that was one of the reasons. So if we attend a 6 IPO Academy, it's a 6-month long kind of education. we will learn what it is about to be a public company somewhere else in Europe. We will also meet European investors and peers seeking to do the same, finding new finance opportunities, and perhaps in a few years or sooner before an IPO.
We will definitely keep our eye on that development then. Thank you so much for coming, Sarah.
Thank you for having me.